Let's talk about the diagnosis of schizoaffective disorder. Schizoaffective disorder is separate from schizophrenia because it involves someone experiencing symptoms of psychosis in and out of a pattern. Schizoaffective disorder includes the person experiencing periods of depression or periods of mania in addition to symptoms of psychosis. In order to be diagnosed with schizoaffective disorder, the person needs to experience the symptoms of schizophrenia, like delusions, hallucinations, disorganized speech, disorganized thinking, catatonic or uncontrollable behavior, and negative symptoms like reduced ability to communicate with others, reduced ability to express yourself or take care of yourself. Schizoaffective disorder looks similar to bipolar disorder in the way that it is episodic. Someone will experience a depressed period where they're not experiencing the same level of symptoms of psychosis, and then once they come out of their mood episode, they will enter a period where their symptoms of psychosis are worse. The hallucinations or the delusions need to be present for longer than 2 weeks, and this needs to be without the episode of the mood disturbance, like the episode of depression or mania. The person is maintaining those symptoms of the mood disorder, like depression or like mania, sometimes even during their periods of psychosis. There are 2 different types of schizoaffective disorder. One of them is the depressed type, where the person will experience major depressive disorder symptoms, low mood, hopelessness, fatigue, exhaustion, lack of motivation, in addition to symptoms of psychosis like delusions, paranoia, hallucinations. And there's also the manic type of schizoaffective disorder, where the person will experience periods of depression, periods of psychosis, and periods of mania. Sometimes during those periods of psychosis where there are delusional thoughts or paranoia, delusions of grandeur, hallucinations, voices, sometimes they will still be experiencing those manic symptoms or depressed symptoms even while they're experiencing the symptoms of psychosis. The way that you can really recognize schizoaffective disorder is if you see someone who you can tell they're having symptoms of psychosis, like delusions, hallucinations, false beliefs, but not every day. They don't have uncontrolled behavior every day. They might not even be hearing voices or having delusional thoughts every day. And you can tell in between when they feel really symptomatic, when the voices or the delusions, hallucinations are bad. They go through periods that look like that, in addition to periods of mood symptoms, where someone is manic, elevated, high energy, reduced need for sleep, impulsive behavior, maybe increased social behavior, or periods of depression with low mood, low energy, reduced ability to care for yourself, and seeing that in between patterns of symptoms of psychosis. Whereas schizophrenia, the symptoms of psychosis never leave the person, except in those rare periods of lucidity